Aphorism 252. But should we find during the employment of the other medicines in chronic psoriatic diseases that the best selected homeopathic antipsoric medicine in the suitable minutest dose does not effect an improvement, this is a sure sign that the cause that keeps up the disease still persistent, and that there is some circumstance in the mode of life of the patient or in the situation in which he is placed that must be removed in order that a permanent cure may ensue. In this aphorism, Dr. Hahnemann has given idea about signs of commencing improvement not after the destruction of Sora. If we find in chronic diseases that during the employment of the best selected homeopathic antipsoric medicine in the minutest and in the most suitable doses does not effect an improvement, does not give any curative results, then it is a sure sign suggesting of some circumstances in the mode of life of the patient or any situation in which the patient is placed which keeps up the disease to persist. Such a circumstances or situations which is the maintaining cause of the disease must be removed in order to get permanent cure. Aphorism 253. Among the signs that in all diseases, especially in such as are of an acute nature, in form of a slight commencement of amelioration or aggravation that is not perceptible to everyone, the state of mind and the whole demeanor of the patient are the most certain and instructive. In the case of ever so slight an improvement, we observe a greater degree of comfort, increased calmness and freedom of the mind, higher spirits, a kind of return of the natural state. In the case of ever so small a commencement of aggravation, we have, on the contrary, the exact opposite of this, a constrained, helpless, pitiable state of the disposition of the mind, of the whole demeanor, and of all gestures, postures, and actions which may be easily perceived on close observation but cannot be described in words. Explanation. In this aphorism, Dr. Hahnemann has given idea about knowledge of aggravation in all the diseases, especially in acute diseases. The signs and symptoms informs us a slight commencement of amelioration or aggravation that is not perceptible to everyone. The state of the mind and the whole demeanor of the patient, outward behavior of the patient, for example, how he stands, how he talks, his gestures, etc., etc., are the most certain and instructive. In the case of slight an improvement, we observe the greater degree of comfort, increased calmness and freedom of the mind, higher spirits, a kind of return of the natural state. In the case of even small commencement of aggravation, we can find exact opposite of this constrained, helpless, and pitiable state of the disposition of the mind and of the whole demeanor, that is, outward behavior, and of all gestures, postures, and actions. These can be easily perceived on close observations but cannot be described in words. Footnote 138. The signs of improvement in the disposition and mind, however, may be expected only soon after the medicine has been taken, when the dose has been sufficiently minute, that is, as small as possible. An unnecessary larger dose of even the most suitable homeopathic medicine acts too violently and at first produces too great and too lasting a disturbance of the mind and disposition to allow us soon to pursue the improvement in them. It must here observe that this so essential rule chiefly transgressed by presumptions presumptuous tires in homeopathy and by physicians who are converted to homeopathy from the ranks of the old school, from old prejudices. These persons abhor the smallest doses of the lowest dilution of medicine in such cases, and hence they fail to experience the great advantages and blessings of that mode of proceeding which a thousandfold experience has shown to be the most salutary. They cannot effect all that homeopathy is capable of doing, and hence they have no claim to be considered its adherents. Explanation of footnote 138 of Aphorism 253. The signs of improvement in the disposition and mind may be expected soon after the medicine has been taken in sufficient minute dose, as small as possible. Unnecessary large dose of even the most suitable homeopathic medicine acts too violently. In the beginning, it produces great and lasting disturbance of mind and disposition, so that we are allowed to pursue the improvement in them. Means here we feel that improvement is started, but it is only the effects of large dose of the medicine. This is the essential rule which is not followed by the physician who are new to the system of homeopathy, or the physician who are converted to homeopathy from old school. These physicians are having their own belief about the potentization of the smallest dose, so they fail to experience the great advantage and blessings of the smallest dose. Experience with smallest and minute dose are most salutary thousands of times. They don't know that what homeopathic medicine can do in its minute dose, and they have not rights to be considered as homeopath.